Welcome, everybody. Welcome to our YTRI and NAPSA hosted webinar. I'm so excited to be here. Welcome, everybody. The comments and letting me know where you're at in the chat just warm my heart. Love seeing everybody. Jessica, welcome from Kentucky. By the way, before we start, you made me think of it. Our hearts go out to our friends in Kentucky that have faced some real devastation. My heart broke seeing the news on the tornado devastation. We've done a lot of work with Partners for Rural Impact. I've stayed in London, Kentucky, that had some of the hardest images to see, and hearts go out. Hope everybody's staying safe and staying strong through some real devastation. So appreciate you being here. Welcome to our webinar today. My name is Jason Johnson. Really excited for another one, and really excited for the content and our panelists. Today, I am co-presenting this with friends and representation from the NAPSA organization that I'll have Doug mention in just a minute. But before we do that, just a welcome and a couple of logistical items. We're scheduled to go for about an hour, depending on how the discussion goes. Occasionally, we may go 5 or 7 minutes past time, but we do record it. So if any of you need to, I know some of you attend during prep hours. If you need to sneak out early, we'll have a recording of it. The other thing that I'll mention is we're on a live webinar link, which means the 4 of us panelists are the only ones with live cameras and mics. So I can't see the rest of our live participants, attendees, but we do keep a live chat for those that are watching live. To help with the chat, it's useful if you'll just take a look at one setting for me. In the chat, if you open up your chat box where you type in your message, right above where you type the message, it says "to," and then there's a little drop down menu. If that does not say "to everyone," when you share your comment, other people won't be able to see it. If it just says hosts and panelists or something else, we can't see it. So if you're willing, make that adjustment to everyone. And then after you've made that adjustment, go ahead. My usual go-to on this, because it makes me laugh and it warms my heart, put an emoji in the chat right now that expresses how your week's going so far. We'll do a quick check-in with everybody that's live, and you can let us know how your week is going by sharing an emoji, a representative emoji. Oh no, in the chat. Oh, and see, we get it all. And this is the time of year where we're feeling all the feels. We're trying to make it across the finish line. Some of us may have had our finish line this week. Yeah, there we go. Very, very bad. And oh, Trina, I feel it. I feel it. Trina, one of our friends there in Kentucky. And yeah, we've got it. Oh, lots of celebrations. We're nearing the end. Well, thank you. Thank you for the check-in. Hope you're doing well. And I'm excited. I hope that this discussion will give you some enthusiasm and some hope and some ideas for whatever your goals are going to be going forward. So with that, let's introduce. I'll introduce the topic, and then I'll introduce our panelists. Then we'll get into the discussion. So as I mentioned, my name is Jason Johnson. I represent the YTRI organization. We've hosted these since 2020. This has just been, it's one of my favorite things I get to do, where we get to have live conversations that we record about really pertinent things in the world of education and mental health that typically revolve around the topic of resilience. Organizationally, that's our specialty. We focus on helping facilitators, teachers, counselors deliver and teach the skills and sources of resilience. But in conjunction with that, we've also built a really fun network where I just feel like I know and get to rub shoulders with the coolest and the smartest people. And we try to bring them on to our webinar to discuss some of these important topics. So today we're going to be discussing the power of connection and strengthening school mental health through relationships and partnerships. Those are a lot of big ideas, but they seem to come up routinely in almost every training or presentation or discussion that I lead whenever I ask people about what they're, what's making life difficult right now for them. Those are continual topics that keep coming up. And so really excited for the panel that we've assembled. This panel it was assembled in part with the help of the National Association of Pupil Services. The last A is Doug, is it administrators?
Yes. Yep.
Thank you. And they always provide the best. We've partnered up in the past on these and couldn't be more excited. So our panelists consist of the following. We've got Dr. Sophia Allman, Director of School Support at Hertford County Public Schools in North Carolina and President of NAPSA. Dr. Allman brings more than 30 years of experience in education, specializing in special education, alternative learning, PBIS, and restorative practices. Passionate advocate for integrated student supports and educator development. Dr. Allman, welcome. And I should say welcome back because you've been on before.
Thank you so much, Jason. It's good to be here. Good to be here.
Next, we have Dr. Paul Barbato, Director of Special Services in the Dumont Public Schools area of New Jersey. Dr. Barbato is a nationally recognized leader in special education and pupil services. He serves on multiple boards and advisory panels, including NAPSA, OSEP's ICC, New Jersey State SEAC chair, and others. Dedicated mentor and university professor, Dr. Barbato is committed to preparing the next generation of educational leaders through NJPSA's programming. Thank you so much, Dr. Barbato. Super excited to have you.
Thank you.
And then last but not least, we've got Dr. Douglas Arnold. Dr. Arnold is the executive director of the National Association of Pupil Services Administrators, former school superintendent. Dr. Arnold has more than 35 years in public ed. He's taught and supported at-risk students and led system-wide efforts to transform pupil services. His leadership continues to shape national conversations on integrated supports and mental health in education. Dr. Arnold, welcome. I'm going to throw it back to you in just a minute. Before I do that, I'll briefly introduce myself. I'm Jason Johnson. My background is worked in public ed as a school psychologist in the state of Utah. I worked for Alpine School District, one of the 50 largest school districts in the country. And then about 9 years ago, I moved over to the world of YTRI, where I'm the director of training and research for them. And my favorite thing I think I get to do is lead these webinars. Before we get into the discussion, Dr. Arnold, I want to give you the opportunity just to give a little bit of acknowledgement and overview of who NAPSA is, what you do. We've really appreciated our partnership with you over the years, and you've provided some incredible panelists to help contribute to these discussions. Doug, do you want to just mention a little bit about who your organization is and what you do?
Sure. Thanks, Jason, as always. And it's always a great pleasure to work with you and YTRI. We do go back a ways. We've collaborated on a number of things, conferences, and you name it, webinars, and we do appreciate that very much. I am the executive director of the National Association of Pupil Services Administrators, and I'm not surprised you couldn't figure out what the last A is, because everybody knows us as NAPSA, N-A-P-S-A. We're an organization that's specifically devoted to issues concerning pupil or student services programs in our schools. In fact, NAPSA is the only national pupil services organization that focuses its efforts on the development of administrators and programs designed to serve the academic, social, emotional, and physical needs of all students. NAPSA is an association of administrators that oversee departments such as pupil services, student services, pupil personnel services, and other similar terms. If you go statewide, from state to state, or however you look at it, there's always a unique configuration or name in many cases as to what we do. But now you have a flavor of who we are and what we do. We are committed to the cultivation of leadership, advocacy, and professional development in the field of pupil or student services. Over the years, as I mentioned, we've had a very strong relationship with YTRI, and we're excited to resume our collaborative efforts as we offer this webinar. We've done webinars before, and I think I'm very proud of the people from NAPSA who represent us. Dr. Sophia Allman has been on before, and Sophia spent many years in Norfolk, Virginia, and now is in Hertford, North Carolina, and she's doing a great job as always. As I said, she is our president and our leader at this time, and Paul Barbato is a trustee. Paul has the past president of our New Jersey chapter and JAPSA, and Paul is an outstanding presenter. You'll find that out soon. Also, I just wanted to tell you, check out the chat for information on NAPSA. I'm going to put our directory information in there. And if you're not already a member, please check us out. It's worth doing. And right now, with the things that are happening in the field of education and really in the field of pupil services in many, many, many instances, is the time for us to grow in numbers and be heard and recognized. Also, I want to tell everybody as we come into 2025-26 school year, we're offering a half-price new member discount for 2025-26. We're also going to be having our annual conference in Pittsburgh, Pennsylvania, October 20th to 23rd, where we're partnering with the University of Pittsburgh to put that program together. And it will be in person or virtual. So wherever you are, you can attend one way or another, and hopefully I'll be able to get some information out to you and let you know more about that. Without further delay, I've talked enough. We're proud to present NAPSA's Sophia Allman and Paul Barbato, both doctors in education, who are joining YTRI's Jason Johnson for today's program. Jason, take it away.
Thank you so much, Doug. I appreciate that. And if you're interested in anything he mentioned, take a look. I know early on as an educator at the beginning of my career, I didn't fully understand the value and the support that associations can have. But this is a real good one. And I echo the sentiment that Doug shared. Particularly right now, it's pretty tough being an educator for a lot of people. And so it's nice to have the strength of great associations behind you. So without further ado, let's get into our discussion. Let's just start off. I want to hear from a couple of our panelists. Just catch us up a little bit. Tell us a little bit about your current role, what your focus of work has been on of late. Let's start with Dr. Allman and then hear from Dr. Barbato.
All righty. Well, as you and Doug have actually said some of my background, currently I serve as the Director of School Support for Hertford County Public Schools. Hertford County is a rural district in northeastern North Carolina, and we're an agricultural town. My leadership focus is on supporting the whole child. That means the academics, the social, emotional, and behavior that our children bring to our classrooms and our school buildings every day. In Hertford County, we do serve a diverse population, and much of our work centers on ensuring equitable access to mental health services, trauma-informed supports, and safe, connected school environments. Organizationally, we are a restorative district. We align closely with North Carolina's Department of Public Instruction's Whole Child Framework and North Carolina's School Mental Health Initiative. We prioritize multi-tiered systems of support, staff wellness, and school community collaboration. As I name all of these things, I want you to also understand that we are a work in progress. For everything that I named, we are steadily growing in all of those areas. Before I left Hertford County, I served in Norfolk Public Schools, that's in Virginia, which is a large urban district where I led efforts in attendance intervention and student re-enrollment and contributed my knowledge and experience to MTSS implementation, student conduct, Title IX, and other student support coordination. That experience helped shape my belief in systems level thinking and the power of relationship driven supports. We can't be a restorative district without having that. And all of that with Norfolk Public Schools is what I carry into my work with Hertford County Public Schools today.
Thank you so much. Just doing great work. Last time you were on, you were in Virginia, and now you've continued this work in North Carolina. Love the mention of restorative models. We had about a month ago, we had a great webinar discussion on restorative practices. If any of you missed that, Dr. Barbato, tell us a little bit about what your current role has been, what your focus has been.
Sure. Well, thank you very much for hosting this webinar and very excited to be here with you and the sponsors of Why Try. Currently, I serve as the administrator or director in Dumont Public Schools here in Bergen County in northern New Jersey. So it's suburban. My experience does extend itself to inner city. I did work in Jersey City Public Schools and throughout the state, working with different schools in a consultant way. My role in this public school setting does entail a lot of what Dr. Almond's experience sounds like in terms of restorative practice. Our district was the consulting district for the state with our tiered system of support early reading grant. And we've subscribed to a lot of different grants here in our school district that deal with mental health. And we've had affiliations with mental health agencies, our county management organizations to have work done in terms of training. Outside of my role, I oversee special ed, guidance, gifted and talented, and also serve as the McKinney-Vento homeless liaison for the district. Outside of this role, I also teach in higher ed. So I teach in teacher prepared programs as well as school psychology programs and other programs that deal with counseling and support for students. So whatever we can provide collectively as a team today, we're happy to answer any questions or give some feedback for questions that are out there.
I love it. Doug always gets us the panelists that just wear every hat within a district, and you two are no exception. You're doing it all. So I think there's great discussion to be had. I want to start off with just talking about current trends. One of the things that comes up regularly for me in trainings and discussions is educators talking about challenges trying to support students that seem to be struggling with mental health challenges within their schools. I'm curious if you can speak directly on it a little bit from your experience. What are some of the trends that you're currently seeing around student mental health and school mental health and the impact that it's having on your students and staff? Let's start with Dr. Barbato and then go to Dr. Almond.
I think that's a great question, and it may lend itself to using school climate data and even just needs assessment data from parents, students, and teachers to really identify the current reflection of those needs. I know for us, we've relied on that data analysis to drive district goals and individual school goals that principals may have in collection with faculty. But what I hear a lot is the need for connection, right? The need for that alliance to be the school building so a student wants to come to school. So chronic absenteeism comes to mind as an undercurrent of need to address, so much that it's part of our monitoring procedure within our state to kind of report if we're over 10%. Hey, what's the action plan? Let's have the Board of Ed approve this action plan and submit it to the county. So all eyes are on it. So it's a focal point. So school truancy, refusal, chronic absenteeism, the need for connection come to mind as the undercurrent of mental health needs. Also, the need for restorative practice when there are infractions against the code of conduct, like looking at disciplinary consequences differently so that kids are able to kind of learn from their experiences, whether it's conflict or perhaps developing a coping strategy that might be more effective than what was used to kind of resolve an existing problem. But when I talk with teachers, a lot of times it's that baseline of wanting to connect with students that they feel safe enough to stay in school. And that kind of opens the door to conversations of, well, what additional supports can we identify to first know what the function of what they're seeing in the classroom is about, like what's behind that misbehavior, what's behind that refusal. So that's what I think of when I hear you ask that question.
Nice. Thank you. Dr. Almond, what trends are you seeing?
So for us, we see some of the same things that Dr. Barbados actually spoke of. We're witnessing a sustained rise in mental health challenges with our students, especially anxiety, depression, different trauma responses, or even having them have the opportunity to become aware of their behavior as a symptom of something that they've experienced. And then that chronic disengagement, which is contributing to chronic absenteeism. Like Dr. Barbados mentioned, we also use survey data. We use Panorama as one of the platforms. So we carefully look at the survey responses from our students, staff, families, and parents, align that with our discipline data and attendance data to look at the overlap, the trends. What is it that we need to address? What is bubbling up to the top, so to speak, across those three tiered areas? The trends I mentioned are present in both urban and rural districts. When I was in Norfolk, yeah, we saw these things spike post-pandemic, and in Hertford County, we're seeing the same pattern. So some of our students are struggling with attendance, some of our students are struggling with peer connection, and some of our students are just struggling with emotional regulation, just being able to self-manage themselves. For our staff, I chuckled at some of the emojis that came in the chat. The impact is real. There's burnout, there's compassion fatigue, there's a sense of helplessness sometimes when students need a space available, some supports. Some of the educators that I work with, their school training didn't prepare them to be mental health professionals for some of the trends that they are working with in the classroom. So I'm thankful to be working in North Carolina because our Department of Public Instruction has recognized these challenges, and they actually have some grants that are funding some school mental health resources and prioritizing social emotional learning integration. Locally, we also use our community partnerships to connect students with outside therapists and resources, and Hertford County is leveraging those resources by providing embedded supports with staff training and stronger linkages to our community partners.
Thank you so much. That's one of the things I get feedback a lot on while I go out and work with educators through like a training or a conference capacity. And one of the things I regularly hear is, I don't feel like I was prepared for this. I feel like I'm having to offer quote unquote mental health support that I wasn't trained or prepared or even necessarily wanting to do. But it's kind of part of the culture of life and education now. Sophia, you used a term just in case some people are unfamiliar with it. You used the term panorama in regards to, was that the term you used in regards to part of the assessment? Is that a specific assessment to your?
It is one of the platforms we use to do our social emotional surveys for students, staff, and parents and families. It's one of our, I want to say partners because we've been using it for a while.
Nice.
When I was in Norfolk, we also used that same platform. Now, I will say my involvement with the platform here in Hertford County and how we actually look at the data and use it to drive the services and supports that we put in place for our students is a little different. But it is a platform that we use for social emotional surveys.
But essentially a platform for assisting with assessment and then connecting with
Yes,
services. Perfect.
yes. Well, it, in a way, it is an assessment. It does not necessarily connect with services, but how we use the data will help us connect students to services.
Got it. That makes sense. Let's talk a little bit oh, nice. Let's talk a little bit about, I want to expand on this idea of connection, and there's a couple ways we can talk about it. One of the first ways I want to think about it is there's this broad idea a lot of people are familiar with, but the idea of like every student needing a trusted adult. That's one of the common protective factors. Like my background expertise is on the topic of resilience and 50 years of resilience research. If you dig into risk factors and protective factors, one of the most consistent protective factors that seems to influence resilience, particularly in youth and adolescence, is that presence of a caring adult. It's this big picture concept that I think most people like agree with the value of. What that looks like in practice in a school setting, sometimes people aren't quite as sure of. I'm curious, what does that concept mean to you? What does that look like in practice? How have you seen it in your work. Let's go, Dr. Allman, and then Dr. Barbato.
Okay, in my work, how I see it, a trusted adult is someone who actually sees the student, who really sees them, not just for their behaviors. They're actually able to separate the person from the behavior or their academic performance, but actually the whole person. In practice, in real time, it means scheduling check-ins with students, actively listening when students actually come to them, providing a consistent presence, and sometimes they're actually the adults in the building that advocate for the student. In Norfolk, we implemented peer advisory groups to help ensure every student had at least one caring connection. And in Hertford County, being student centered is one of our core values. So we're building similar systems through our professional school counselors, behavior support coaches, social workers, and even bus drivers and custodians. As you all know, every adult in the building has the potential to be that trusted adult for some student. We intentionally work on building these relationships through advisory programs, check-ins, peer mentoring systems, and we have restorative centers. Dr. Barbados mentioned having that alternative place to go instead of an alternative to suspension, so to speak. So in these centers, we have set up in all of our schools except our primary school. Students can go there because of some type of conduct concern, reflect, rethink, and return after receiving interventions from the R3 coaches. When students know that they have someone that they can count on, a lot of times it is the coaches, it directly impacts attendance, behavior, and achievement. We've actually had students return to school, avoid crisis, or re-engage simply because of that one caring relationship. Most of our schools have innovative Fridays where advisory times make up part of that daily schedule. So when students feel known and safe, it opens the door to learning, growth, and healing. We see better attendance, fewer discipline referrals, and stronger engagement. So that's what's happening in Hertford County Public Schools. When I'm doing the long-term hearings, one of my questions to the students sometimes is, do you have a trusted adult? And a good amount of the times the students will name someone, but there are some times where the students just hang their heads and say no. And so that's an area that we have to work on because it's so important.
What a great, simple check-in. I get goosebumps here. You're talking about every adult in the system being a source of connection. This is exactly why I needed you back on here. These great thoughts. Dr. Barbato, Paul, what are your thoughts on that idea of the trusted adult, what that looks like in practice?
I think it's crucial, so when we think of situations where we have this structure in place, it really is for the student who may not have responded to other interventions and maybe classroom management techniques haven't been effective and need a boost, or if the student is not doing homework, or if the student is not being involved, or has that sense of belonging to the building, and you're seeing that maybe with tardiness, with absenteeism. So what we've implemented is a tier 2 strategy called check in, check out. And every staff member has really taken ownership in terms of being invested, similar to what Dr. Almond shared with that group approach, where there's almost like a list of students that are on and assigned and allocated to a staff member at arrival, midday, at dismissal, multiple parts of the day, that this trusted adult, as you described, Jason, kind of meets with the child to kind of have some questions answered or some goals that have been identified ahead of time. This way, there's almost like a personalized approach. We use this website that's free, and I'll drop it in the chat, and it's PBIS World. And in the chat, you'll see they're all links to some free forms to utilize for the teacher, for the specialist, for maybe working with the parent. But these are good samples to start with in case you're wondering, like, how do we set this up? And ironically, a few years ago, I provided some training to our instructional assistants on this topic. And I showed an Edutopia free video about this principal working with the staff and working with each child. And the principal was involved in this check-in, check-out procedure. Do you know that that inspired our instructional aides to say, hey, can we do that? I have like 3 kids I'm thinking of. And that started a conversation to make it school-wide. So I think it has to start small And that when you have that kind of drive to make a difference, to make that connection, as you're kind of, alluding to in your question, that's needed to kind of have this be successful, I think it'll just pick up very nicely. Another program I just want to mention that's very helpful for homework, organization, and planning skills is exactly called the HOPS program. And we have a parent version and a school version that our psychologist or school counselor or social worker will work with the student, whether small group or individual. And this has really been a game changer for students who need that executive functioning kind of additional support. And again, it could be considered one-to-one. Parents love it because it really works hand in hand with a lot of concerns that we hear from home. And that's again a tier two strategy. So those two come to mind to kind of get at the core of what would we be able to implement tomorrow.
Awesome. You said that was the HOPS program. Cool.
I'll drop a link in the chat.
That's perfect. Thank you so much. Those links are awesome. I want to stay on this theme and maybe explore in a little more detail what some of these um, what some of these ideas look like in practice. I think that's what a lot of people kind of struggle with. These are those things we talk about, big picture ideas. Most people agree with it. But then what it actually looks like in practice, how you get it going, how you can start small and then kind of land and expand. What that all means is sometimes the tough spot. So I'm wondering if you could just share a little more on this idea of connection. What does it actually look like in practice? And if you want to share a little more detail on some of those, like I'd love to hear a little bit more about that program you said. I think it may have been part of your check-in, check-out. You started small with 3 educators, expanded out. What's that look like? What does it look like when it's working? What's missing when it's not working? Dr. Barbato, let's start with you and then throw back over to Dr. Almond.
It's interesting when we had a review of students in need of a risk assessment or threat assessment interview that drove our awareness that there may be a need for additional support, that really sparked discussion around, well, what additional support do we need? So we linked with a mental health agency to kind of bring on board that's kind of parallel to the support services that we provide, some clinical services to make our setting, our public school setting, therapeutic, because any school can be therapeutic with the right supports. So with that in line, we were able to create a classroom and convert it to what we call a wellness center. And that wellness center has our clinician from a mental health agency. And so that really has been a hub where kids can go, whether they're transitioning from psychiatric treatment on back to school for maybe a full day to a partial day, or if they are on some modified school day and need like an anchor of a location to start the school day for therapeutic support. So the check-in procedure really started with every kid. However, for students that were on the radar for more concerns that needed heavy intervention, we've really brought in outside and internal supports and worked together on making sure that we were consistent in our approach. So what does that look like? It looks like trauma-informed teaching training for teachers. The whole staff receive training on that. And we have a procedure that involves a threat assessment kind of team that is formed to kind of identify kids that might be on the radar for additional support and services. So part of that training for the whole district involved this trauma-informed teaching and trauma-informed care. But in conjunction with that, learning about adverse childhood experiences and really expanding our understanding of what is the student walking in the building with that we're unaware of. And then that kind of expanded the discussion. Well, wait a second. How do we get to know if this is happening? So our state put out a really cool resource last year that looked at assessment practices and screening measures under the umbrella of mental health. And I'll drop it in the chat so you have it as a reference to review. But we've done a lot of great work with honing in on school level teams and district level teams to make goals tangible in order to see whether we need to bring in specialized training or perhaps looking at reset corners in every classroom. We really have provided a lot of training in what's called the Nurtured Heart approach, which was affiliated with the grant from our State Department. And this Nurtured Heart approach really speaks to what you're asking about, like how do we make those connections tangible? And the Nurtured Heart approach looks at how we recognize children, not for what they're doing incorrect, but when they are making a decision when they had other decisions that they could have made at that time. So looking at active recognition, experiential recognition strategies, and really honing in on what that looks like to correct an issue or to kind of prevent and kind of pre-correct an issue from happening.
Thank you. I'm writing notes while you talk. I always do this. One of the phrases you mentioned has come up multiple times in previous webinars. You mentioned the adverse childhood experiences. That's in reference to a thing commonly referred to as the ACEs assessment, and it's a way to assess the basically kind of like the culmination or the quantification of traumatic experiences that a young person has been exposed to, because those tend to influence how we interact with the world, how we interact in public spaces, how we interact with education. And so it's, if you look at some of our previous webinars, this has come up as an important piece of the puzzle, particularly in supporting students in trauma-informed models, and it's a key piece. I'm glad you mentioned that. Dr. Allman, tell us a little bit about your view on this, what it looks like when it's working, what's missing when it's not. What are some of the things you've done in practice there around this concept of connection?
Okay. Well, in general, when the connection is working, it looks as simple as staff greeting students by name, learning their names, greeting them by name, learning something about them, to have those small impromptu conversations, which is one of the restorative practices. School counselors hosting small groups, maybe even lunch groups, different teams, whether it's from school support or collaborative efforts across disciplines, proactively checking in with families, not just my school social workers, who are my ecological model when it comes to school related matters. It looks like those restorative conversations instead of those punitive responses. I love that Dr. Barbado actually mentioned the ACE scores. That's one of the things that I realized that I have not addressed since being here in September, that I need to revisit training on that with my staff. We do have the behavior threat assessment teams in place. That's something that North Carolina rolled out this year. And I love the behavior threat assessment management process, because it does involve identifying those additional interventions and supports students need to keep them off of the pathway to violence, to address certain behaviors that have come up that's keeping the entire school safe. Um, of course, that's a multi-lens approach. So what it looks like, you have a variety of lenses at the table. You don't have your administrator calling all the shots. You have your administrator there to offer their input, your school counselor's lens there, or your mental health professional. I think we call it specialized instructional support personnel in North Carolina, offering their perspective. There could be a teacher, an instructor in the room as part of the team who's offering their perspective. But the idea is to support this child, to actually offer some interventions for this child. When it's missing, we see isolation. We see students isolating themselves. We see students disengaged. We see escalated behaviors. When you have different staff as parts of team and they're not really to contribute to the conversation from their lenses, that's also something that when that connection is missing, you see that too. A connected school community prioritizes relationships, excuse me, before rules, even though the rules are very important and should actually be included in that framework, that PBIS framework, clearly, explicitly sharing expectations, and ensures that mental health supports are not just siloed, but actually integrated across all areas. We keep talking about the top three: academics, behavior, and attendance. So that's my take on connection.
I love it, and I appreciate the callback to that restorative model, particularly in reference to check-ins and conversations. I feel a little bad doing this to you, but Sophie, if I could put you on the spot just a little bit, what like just very broadly speaking, like for somebody that may not be familiar, because I know we have some people on here that may not be familiar with the restorative practices model, like what would be a difference between a restorative conversation versus a non-restorative conversation?
Well, you may not know. When restorative conversations are looking through the lens of what harm was done and actually trying to repair harm. So it may be with a student to student or student to staff. Something has happened, harm has happened, and it's a line of questions that doesn't necessarily start with a why, because sometimes when you ask why, it sets people on the defense, but it's almost a what happened, what were you thinking? It's actually trying to get individuals to be aware of where they are or where they were at the time, and then acknowledging or being aware of how their actions or words affected someone else, so that they actually can be aware of the harm and actually repair the harm if necessary. So I'm trying to think of an example of a Jason, I don't know off the top of my head if I could come up with a
I
restorative.
think your description is
But
really
you have those
helpful though.
affective statements, affective questions, the small impromptu conversations, those proactive conferences, and depending on the severity of things, with trained personnel, you would have those restorative conferences.
No, that's exactly what I was looking for. You I think you hit it just perfect. And it's, I think it's one of those subtly powerful things that allows the adult that's kind of leading or administering the conversation to be able to separate the thing that happened from the individual and still see and maintain like the value in the individual, because sometimes the harm that happened may have occurred to one of the grown-ups, and so it's easy, sometimes we've all been in that situation where we may not be at our best in a stressful situation, we may not really be contributing positively in a connective way, and that restorative model I think is a really powerful model that can help us maintain a good perspective to try to draw out best results from that. So awesome, thank you for letting me put you on the spot. You gave a perfectly eloquent description. Let's continue this idea of connection, and I want to expand out a little bit into the how. You both have kind of casually mentioned, as you've talked through some of your approach to this, how you lean on partnerships, whether they're internal partnerships within the school or district to support that you have, or community partnerships. Wondering if you could just expand on that a little bit and maybe share some examples of key partnerships, whether inside or outside the schools, that have helped you to support your mental health efforts within your schools. Let's start with Dr. Allman and then go back to Dr. Barbato.
Okay, so being new to Hertford County and new to North Carolina, I had to learn some of the resources that we have within the county. Um, As a result, I know we heavily rely on our partnership agencies like our Trillium Health Resources, Integrated Family Services, that's in this area. Our regional health partners, Roanoke Shawan Community Health Center, actually has a school-based health center in our middle and high school that provides some behavioral support and services to our students. We're getting ready to partner with Albemarle Regional Health Services that will actually provide school-based therapy to not only students but staff as well. That will include crisis response and some wraparound services. Some of you may be familiar with the agency Communities in Schools. That agency supports our middle school. And then I don't know where we would be without gaggle safety and gaggle therapy. You all may be using a different means of monitoring what the students say and do online, but gaggle safety, there are certain people, especially school support staff who and administrators who receive alerts when students type certain things. And as a result, we can jump in and intervene. Um, Dr. Barbado mentioned the risk assessment. You know, certain keywords like suicide or anything related to that, we get calls and emails and buzz to, hey, are you aware of this? This is a high alert. I reach out when the emails come to me and say, I need you to follow up with this student. Let me know the results of the risk assessment so that we can intervene early and often with our students. Some of them, as a result of that proactive approach, we refer them to gaggle therapy. Gaggle therapy is an online service platform, so to speak. We're able to fund it through, I mentioned grant funding through the North Carolina Department of Public Instruction. They're taking supporting our students very seriously. So I don't know where we would be without those particular partnerships that we use to proactively intervene to support our students. Internally, we collaborate with my entire team. I supervise the nurses, the professional school counselors, the social workers, the behavior support coaches, and we work with the administrators and the instructional personnel in the schools. We are a team, and we actually sustain these partnerships by just having regular conversation, sharing our goals and objectives, reviewing our data, having the data drive the actions that we take, and looking at joint training opportunities that we can actually strengthen each year. Right now, we're planning for our summer training, preparing for the next school year. To build new partnerships, I told you I was new to Hertford County. We had a community meeting, community stakeholders meeting not too long ago. So we included law enforcement, the district attorney's office, the Department of Social Services, just to name a few, juvenile court services was not represented but invited. And we have the prevention, juvenile crime prevention, excuse me, council that we also partner with when those behaviors are just a little, there's been a pattern of behavior that we need to address, and we don't want to get them involved in the court system, so we go through diversion using some of the entities part of those committees. But we just, at the beginning, when you're just getting started, I recommend just beginning with shared needs assessment. Dr. Barbado mentioned needs assessment earlier, and inviting community partners to the table early. Be very transparent and consistent. I love that my superintendent will say in meetings, we are being very transparent. Here is our data. Now, mind you, it's not drilled down data, but here is our data. This is what we look like. This is what we hope to do. How can we partner to make improvements? And that will go a long way with consistent, if it's consistently enacted, to forming strong, lasting connections.
Love it. You read my mind. I was going to ask what your approach was being new in the area to partnerships, and that was perfect. Also, by the way, that's the casually the second mention of gaggle therapy we've had in like the last 3 webinars that I've had. So, kind of interesting resource that seems to be gaining traction. Dr. Barbado, what are your thoughts on the forming partnerships, the importance of it, what yours have looked like, how you've gone about it?
Sure, great question. And we've really relied on our affiliations with institutes of higher education. So one that comes to mind is our affiliation with Fairleigh Dickinson University here in Jersey. And originally, we had professors from the Department of School Psychology and graduate students observe our intervention meetings, our intervention and referral services committee meetings, to kind of give us feedback in a consultant way of what can we do to improve how we're identifying this request that a teacher may have for consultation, and then during that consultation process, developing an action plan of strategies and evidence-based ideas to consider across the content areas, even if it involves social emotional kind of support. So based on that partnership, we were able to establish a long-standing relationship so much that we've aligned courses within the school psych graduate program, one in the fall, one in the spring. The one in the fall focuses on academic interventions, and part of the practicum experience required in the course, guess where they are? In our district. And they work in the classrooms, they take data, they're working alongside a teacher who may request consultation from that building-based team, and they're making sort of like the role of, okay, this is what a school psychologist will do eventually. I'm getting this practice in this coursework, but they're also helping us kind of collect data, make informed decisions, let data drive those recommendations in the action plan development. And then in the spring, their course that focuses on behavior, then we're looking at an FBA, functional behavior assessment. We're looking at a series of observations that drive those deep discussions of what function the student may kind of the behavior may be serving the child, whether it's access to a tangible, access to sensory, perhaps escape, avoidance, all that stuff, and then drive some intervention discussions that way. So that partnership really resulted in anchoring support vehicles for our school district to utilize very effortlessly. Another idea that was brought into action was this whole access to clinical counseling. So earlier I mentioned that when we have a student who has received a risk assessment interview or threat assessment interview, if that results in some action step, whether it's securing consent from the parent for ongoing school-based counseling, well, we now have graduate students that are in the school psych program or the school social worker graduate program that serve as additional interventionists and provide that direct counseling with the student under the supervision of our certified school personnel. In addition to that, we've had our graduate internships provide training to parents, whether it's depression, whether it's risk of maybe self-harm, or interventions working with anxiety, or looking at the issue of self-care as a family. What are some ideas to consider outside of school? So we've really leveraged that support in this consultation with higher ed. In addition to that, we've accessed support from our county's care management organization. So we have 21 counties in our state. Every county has like an organization that supports schools and supports families under a different department, and a children's system of care, which is what the umbrella organization is called. And as a result, parents who need additional support, whether it's mobile crisis, whether it's support in the home, access a primary access number called Perform Care. So what we do is we have quarterly meetings with similar personnel that also serve as case managers, but they're called care managers. And we talk about the shared families that receive support outside of school. And these meetings are really important because they have a structure called a child family team meeting, which involves the school personnel on the various supports that are provided by their agency in the home. So a lot of times we're working side by side with personnel that are in the home, and we provide trainings together. I know in one particular area, I provide the special ed overview for their new personnel that are working with families that may have a child with an IEP. So it's a mutually beneficial partnership, but I can't tell you the benefit because out of that partnership, we've had back to school night presence from representatives from the organization that share with parents, okay, this is what you can do if you're having difficulty at home. And you hear the school counselor, the building principal, the teacher hearing this information. So guess what? It generalizes to common knowledge now, builds that fluency of support. So that's another benefit of this affiliation with our county. As a result, this school year, which is new for us, we have a clinical intern from that agency. So we're providing the supervision needed for her clinical hours for her licensed social worker license, and it's a mutually beneficial partnership. So I would say, just to sum up the ideas, graduate level internships, trainings that are linked to existing coursework, working within the public school, then looking at our county organization to provide additional support for parents to access.
I love it. And I will add my endorsement to all the ideas both of you shared. Just thinking about it, I've been on both sides of it, but I think people forget about the partnerships with higher education sometimes. If you are near any higher education institution that has a school psychology, school counselor or school social workers program, shoot your shot, reach out to them. They're always looking for partnerships. They're a great, consistent resource that can be so helpful. And then Sophia, just to add emphasis, I'm so glad you called for transparency and self-assessment. It's one of those things as the grown-ups, we know the value in assessment for our students. To help our students grow, we have to be able to assess and see where the deficiencies are. But it's really hard for us sometimes to apply the same lens of assessment to us as the grown-up facilitators. But it's the same model of growth. We have to recognize, honestly, where we're coming up short to be able to address those. And so, love it. I've got one last thing I want to cover with you. We may go a couple minutes over if that's okay, but I do want to get to some practical ideas. And so I'm curious if you'd be willing to share just some practical strategies, just to kind of bring it full circle. We've talked about connection and the trusted adult and challenges that you're seeing. Bring it full circle and share, if you're willing, some practical strategies that anybody tuning in could use to try to build stronger connections, to improve partnerships. And as you're thinking about it, if you have anything as well, keep in mind that we do have people on here that may feel like they're a little bit on an island in their school or in their district. They may not feel like they have the support that they need. So if any of those strategies are particularly helpful to somebody that's just starting out and may need to start small, keep that individual in mind as well. Let's go Dr. Almond and then Dr. Barbato.
Okay, well, some of the things I'm going to say we've already touched upon. The trusted adult. So if you take your student roster and you take your teacher list and you take the time to ensure each student is connected with at least one adult from the very beginning, that's something practical that can be done. We mentioned the advisories or the check-in, check-out systems. Um, have your staff, I have to have my staff actually build in time, put it on their calendar, um, schedule time into their week to actually have the structured relationship building, whether that's incorporating the restorative circles, whether that's incorporating the journaling, whether that's incorporating the lunch brunches. My school social workers want to work on this ABC club idea to address attendance. My school counselors want to build spaces or create spaces for I want to call it the mental health woosah moment, because there are spaces in our building. Our staff is limited. We are a district of 2,400 students, Hertford County. As far as the tiered interventions, I think most people are doing things with tiered interventions, maybe not everyone. Use your data to identify students in need of support and match them with appropriate services. I'm having my team, that is going to drive their work next year. I mentioned earlier we had the panorama data, our survey data, and I mentioned social emotional things, but it's climate as well. The panorama data, the attendance data, and the discipline data. That's going to guide the push in options that my school counselors are going to do. It's going to guide the individual supports that my school social workers are going to do, or maybe even the parent and family connections that they're going to do. My behavior support coaches are going to be looking at that data to know what classrooms they need to go into, because based on some of the teacher survey data or the discipline data, and this particular teacher has had more office referrals, but you look at the type of behaviors that are surfacing, you know that there's some root causes that need to be addressed, so that behavior support coach will be able to go in and support that teacher. So using that data to identify students and then matching them with that support. I mentioned the social workers when I get ready to say family engagement. We're already discussing at minimum 2 parent nights in addition to open houses and all those things. We may do 4, one each quarterly grading period, but we're right now looking at one in the fall and one in the spring. And then that internal collaboration. I can't stress enough that idea to have multiple lenses at the table how people see things, it contributes to a very beneficial conversation. Start small, one grade level at a time, one team at a time, and just build from there. I can put a North Carolina link in the chat just as a starting point, some resources that they provide school divisions here.
Awesome. Thank you. Dr. Barbato.
Sure. Three things come to mind. So one thing I do every school year, and it's really great, it's a game changer for me and the case managers and the teachers and the principals. We use a profile called the Positive Student Profile. It's free, and it's from our statewide Parent Advocacy Network. And it provides an overview from the parent's perspective for the new teacher starting the new year, right? What to expect? What are some challenges? What are some strengths? What does the new teacher need to know about their child? But there's an all about me section that the student is able to voluntarily provide information on. If the child can't, then the parent can help and maybe answer on behalf. So that's been a game changer for us because the case manager then, or school counselor, will go to the teacher, review the information. This way, the grade level, the teachers working with that student and family now have additional information beyond, say, an IEP or beyond what perhaps is known already from the student coming to the next grade. Number one. Number two, we've redesigned what our faculty meetings look like. So twice a month we have standard faculty
Sorry.
meetings. Once a month, we have what's called professional learning communities. So the teachers will, at the beginning of the school year, sign up for a topic they want to delve into in research, and then they'll have an hour a month, 10 hours for the school year, for 10 months of the school year, half of the requirement of 20 for the school year for our state, 20 per year, that they've worked in a small group in a PLC, and then in the spring, they presented to the faculty what they found. We've researched chronic absenteeism interventions, we've looked at school refusal, all the topics that we're talking about today, even some academic ones, looking at early reading and writing. Number two. The third is really to look at this idea of having, similar to what Dr. Almond started to share, about getting the class list and having teachers as a faculty go one by one. What do you know? What you don't know? And then identify from that list the kids that are unknown. And then you kind of develop, okay, this is our group of kids that we need to know more about them. And that kind of sets the tone for every student matters, and this is what we're doing about it as a faculty. That's what I think I would encourage a new person starting off in a building, or if you want like a fresh pair of eyes on an old scene, that might be a way to go about it.
Love
Jason,
it.
if I could,
Yeah.
could I jump in just for a second? You talked about being on an island. A lot of times, new folks feel like that pretty much right away. In many cases, I think we all felt that way at one point. The other thing is, though, not only you could be a veteran and sometimes feel on an island, particularly in the field we're in, because sometimes, we're handling things and that others don't quite understand. And that's one of the reasons that I think, and you talk about connectivity and connections, and I think collegial relationships and networking is something that our organization provides. As you can see, our board consists of experts in our field, and they are available to people who in our field who want, seek some advice, seek some information, or just sometimes some validation as to what they're doing or how they're feeling. So that's why it might well be important, I think it is, to join an organization like NAPSA to get that support.
Awesome. Perfect wrap up. Thank you all for your comments. This has been fun. I've been really intrigued and fascinated by this concept of connection for some time. It seems to be an ongoing conversation in the world of mental health, in the world of education, and even broader than that. My own hypothesis, I think something broke, like in the social obligation during COVID, where I think all of us kind of walked away believing that we can do without some of the connection that we kind of had to live without. And that's one of the biggest pieces that I think still hasn't repaired. And we're seeing the impact through behavior challenges and motivation challenges and all attendance challenges, all these things that are still, and in some cases even more problematic than they were before. And I think connection plays such a vital piece to it. You know, we're humans, I think, are hardwired for it, and it underscores the importance of what we're doing as educators and mental health providers. So thank you so much for bringing such great content. I want to conclude with one question for you, and I'm going to put up contact information while you consider the question. But before I do that, I do want to remind that Dr. Almond is the president of NAPSA, and thank you for the work that you're doing. I think, Dr. Barbato, you have a role. I can't remember. I apologize for not having it, but Doug told me that you have a role there as well. But Dr. Almond, anything you want to mention as far as upcoming NAPSA events or focuses?
Well, we do have our largest event, our conference that is occurring in October. Watch me mess up the dates. The October 20th through the 23rd. That's Sunday through that Wednesday. Always an awesome experience, a lot of information. You may think that it may be just relevant to the state in which it's being held, but we do a great job trying to embed information that is national, that is beneficial to all of us. All of our vendors are listed on our sponsors are listed on our website, and often, just like Why Try, they have webinars that you can take advantage of. Check out our website, check us out, consider membership. I saw some of our states represented, but I saw some others like New Mexico and California that were not. Come join us. Give us a thought. Give us a chance to show you just what we're able to do. I've grown with NAPSA. I've grown with NAPSA, and I've benefited from being part of the organization.
Awesome. Thank you. Here's the question I want to conclude with. And by the way, Dr. Barbato, there you had a request for if you could share the 3 steps again, if you have those on hand. You can either type them in or you can share it when you give comments here. Last question I have for you, just share something that's given you hope in education right now. You know, I think a lot of educators feel really exhausted with good reason. It's a really challenging time. I've done this as a trainer for 9 years, almost 10 years, and this is the most exhausted I've seen educators. So let's end on a high note. What's something that's giving you hope in education right now? Let's start with Dr. Barbato, then we'll go with Dr. Almond, and then Dr. Arnold. I'd love to hear from you on it as well.
You know, believe it or not, what gives me hope was our NAPSA conference last year. The presenters were outstanding, and we had topics that we're talking about today on chronic absenteeism, and we had some really big presenters. So I'm hoping that everyone sees that link in the chat to this October's conference, because it's going to be wonderful, and the agenda is already posted. But that gives me hope to kind of hear from experts nationally around the issues that we're talking about today with concrete ideas for us to consider. What also gives me hope is an email I got yesterday. And it was an email I got from our psychologist who had gotten an email from a student thanking her for helping him, or thanking her, the psychologist, to helping him throughout the school year. Because without her support daily, and this is something I was unaware of that she had done daily, like we're talking about daily check-in, this child was off my radar, but it wasn't off hers. So that gives me hope that there are professionals in our field that are doing the right thing on their own based on what they feel they can do in a way that helps support students when they need us most. So that gives me hope.
Love it. Dr. Almond.
Mine will be shorter than that. I was going to say the resilience of some of our students, the things that they are living through every day and still coming to school and being able to connect with us and still connect with learning, that gives me hope. And then that group of staff that still represent the heart of education. I see the work that we do as the heart of education, and to still run across work with staff that actually care about students and care about seeing them move from childhood to adulthood in a healthy, safe manner gives me hope. Gives me hope.
Love it. Dr. Arnold.
Well, two examples who just spoke give me hope. The tremendous people that I am involved with on our executive board and it's in our membership, and then in some of our state affiliates that I know so well. Uh, we have got terrific people in the field. And to be honest with you, you can have the greatest curriculum in the world, but it isn't going to matter if kids are not comfortable in their own skin and ready to learn and ready to feel comfortable in that school environment. And that's what we do. And the fact that we have so many great people involved in that process gives me hope. And also, to be honest with you, Jason, you folks from Why Try and others that we have developed partnerships and sponsorships over the years with, and those products that we have and those things that have been test driven that we can bring to our members gives me hope. There's a lot of great people out there, all working for the same cause. And it's tough right now. I've never seen anything like it in all my years, and I'm kind of old right now. But I'll tell you, I do have hope because of the wonderful people who are dedicated educators.
I love it. Thank you so much. And I'll add my answer. This is the time of year where graduations are happening. My home district that I live in just had their local graduation yesterday, but they do this really cool thing they started doing a couple years ago where the local elementary schools invite the high school graduates that attended that elementary school to come back and they do an elementary walk. And so every year, the day of graduation, the high school graduates that went to that elementary come and walk in front of the elementary students. And it's a really fun thing, but it's this reminder that it's a village. It's the elementary schools were just as critical in getting that student across the graduation finish line as the middle school teachers, as the high school teachers, and to connect back as a way to show to the elementary kiddos what they get to look forward to. It's a really fun thing. Really proud of my community for doing that, and all of that gives me hope, and the young people in general. You know, we've got some outstanding young people that are going to go out and enter this complicated, complex world, and in many cases they're going to make a difference because of the connection they had with grown-ups like our panelists and all of you that are attending. So thank you, everybody. This was fun. This really recharged my batteries. This is a great time of year to be having these conversations. Wishing you all the best as you head into your summer, charge your batteries, and then have the important conversations that need to be had. Thank you. Huge thanks to our panelists. Give them a big round of applause. Huge thanks to the NABSA organization. Really appreciate our partnership with you all, and you continue to connect me with just the best humans. Paul, Sophia, Doug, thank you all for being on. And then huge thanks to our attendees. Thanks for showing up. Thanks for doing the work. Thanks for doing the hard work.